Yeah, this is Sugar Bear. Oh, that's right. I'm trying to figure out what's the matter with us. All this evilness among black on black. Why? What is going on? To know better is to do better. You heard me? Wow. Come on, y'all. We better than this. We need to bring it back. Respect one another. Love one another. That's all I'm gonna say. Anyway, say hold up.
Good evening, everyone, and thank you so much for joining us this evening for Conversations, our community conversations. I am Garcia Williams, the Executive Director of the Medi Community Resource Center, and it's my pleasure to host you for our culminating event for National Recovery Month. The Medi is in partnership with the DC Prevention Center in Ward 3 and 4, and through grants provided by the Department of Behavioral Health, we've been able to provide outreach to the community throughout the city, but more specifically in Wards 3 and 4. So tonight we're going to have a series of conversations and more enlightening and educational opportunities for you as community leaders and members to understand some of the issues that affect our communities as they're related to the opioid crisis. This is a crisis that speaks to each of us in a different way. Oftentimes, when you read the headlines in the newspaper articles and you read about the fatalities related to the drug epidemic within our communities, you may feel that it's somewhat at a distance from you. But when these numbers start to mount and things affect our communities, they affect each of us individually. So tonight, we're going to take a pause to share some ideas and some thoughts on ways that we can become more involved. And again, resources that are available to us to assist those in the community with the greatest need. So it is my pleasure to introduce my cohort, Mr. Larry Gordine. And Larry is the Program Director for Peer Recovery Support and Services at the Psychiatric Institute of Washington. So Larry's going to join me very shortly. And I do want to make one quick comment is that we are founding members of the Partners in Care Network related to support services. And within that community. So Larry is a part of that effort. The Medi Community Resource Center is, the Medical Home Development Group, and there's several others, but these are the founding members of the organization. So kudos to each one of them for the work that we're doing. And now here's Larry. Larry,
Good evening.
Good evening.
Good evening. And thank you so much, Garcia, for that wonderful introduction. And it has been a truly exciting National Recovery Month. The struggle continues.
Yes.
We are on the front lines, bringing as much compassion to the individuals and families in our community that are in the grips of addiction, and particularly with the opioid crisis, taking such a toll across the spectrum.
And Larry, that we've been involved in a couple of different areas, particularly on National Recovery Month. And you've told me before, and I've heard you say this before, that it's not Recovery Month, it's Recovery Day, daily, yearly. Everything revolves around that. Talk a little bit about what Recovery Month represents for you and what the work that you've been doing at PIW.
Yes, of course. Every day is Recovery Day. It's 24/7, 365. And Recovery Month just brings, a culmination and just a national recognition both of the challenges before us and the work that we all are doing. And of course, most importantly, is to truly celebrate the individuals who have made that step, who have established themselves in recovery. But at the same time, truly keeping our focus on those who are in treatment and not yet in recovery. And of course, all of those who need treatment, who need to be in treatment and have not made that step at this point. And so, with this and with this focus, we are really using this culmination of this very exciting 2022 National Recovery Month, to really launch every month is Recovery Month, starting in October.
So, Larry, some of the things that we've done together, and that's why, when I look back on the calendar and when we had this opportunity with this grant, the Prevention Grant in Ward 3 and 4, we've done a series of workshops. We had R1 Learning with Tom Carl. And for those of you that didn't have an opportunity to be with us with that effort, there'll be additional opportunities for us to share some of the insights from R1 Learning. We've also had a series of community webinars provided by Joanna Dolan and Dolan Research International. We also had a preview and also a full view of this documentary called Tipping the Pain Scale. And let's take a few minutes to share a little bit about Tipping the Pain Scale, because I think that was one of the capstones or one of the highlights of everything that we've done throughout this series.
Absolutely. And the Tipping the Pain Scale really, took our efforts and our outreach, and it took awareness to a whole nother level. And it's a full-length documentary done by Greg Williams and his incredibly talented team, featuring individuals and leaders who are in recovery, but are really doing this work. And we were able to feature a series of the documentary showing in Ward 3 and in some of the other wards as well. But the documentary, one of the headliners and one of the programs we had was Secretary Marty Walsh, and who is Secretary of Labor in the Biden administration. And he really brought it to life, and that he too is in recovery. He's a recovering alcoholic. And he was able, during his run for mayor of Boston, to really totally galvanize the recovery community and really brought to light. And then at the same time, we had so many other outstanding individuals who were featured in that documentary. So it is a must-see. We will continue to feature the documentary as well as vignettes. And so really, if you haven't seen it, we can get you connected with it. But it was a truly outstanding way of really capturing and really kind of setting the tone and the pace and celebrating how powerful recovery can be.
Perfect. Thank you. A couple of other things that we did throughout the month. We had a special Narcan training session for the peers at PIW. And that was very enlightening for me because I've been through a series of training sessions, but this one was more specific because it was taught more directed at the peers. And it gave me a different level of understanding about that. We talked about the Good Samaritan laws and things that protect us as citizens when we choose to take action to support those that we think may be in an overdosing situation. But we're going to talk a little bit more about Narcan as we get further. Other things that we did, and Larry, I think you've been, not think, I know you have, we've hosted vaccine clinics and booster clinics for those with within the substance abuse population. Because even though we focus on recovery, sometimes we don't look at the overall health and well-being. So do you want to share any insights about that and ways that we were able to support our population and the community that has the need through recovery?
Yeah, it's still 500, 500 people dying every day from COVID. So the COVID has been a worldwide threat, as you know, and particularly in vulnerable populations. And that's exactly the population and community that we serve. And unfortunately, there's also been some stigma and some hesitancy around, the COVID and COVID vaccine. And so we really took that opportunity to really partner with the Medi and with peers and the community and host actual and support vaccine clinics. And we did that through our Partners in Care Network with many of the providers in the Partners in Care Network, and reaching out to shelters and reaching out in the community and really incentivizing. And the uptake has really been fantastic, using an incentivizing model to get people attention and to get them to take the vaccine and particularly the boosters.
Perfect. And then we had community conversations facilitated by Janetta Joyce from the Ward 3 Prevention Center. And that was a way of gaining further insights from the community about the needs and their perspectives on what's on the street, the voice of the community at a level that we may not be able to understand. And one final piece was a really major capstone where we honored Jamie Freeman. Anyone who knows Jamie or who knew Jamie, because I still speak about her in the present tense, really had an opportunity to pay homage to her and her legacy within this peer community. The Medi is taking the next step to honor her as one of our trailblazers posthumously because of the work that she's done within this environment. So we've had a very busy month. We've been engaged in this effort. We're in it to win it. We're not giving up. We're not stopping at any level. But now we want to transition to talk quickly about one event. And Larry, you introduced me to this, and I was able to share or to serve on a panel at this particular event. And Ambrose Lane helped us to understand more about the plight of the community. So I'd like to bring Ambrose into the conversation and have him share a bit more and maybe a highlight of that event that we attended. Dr. Bazran was there. There were several community leaders that were part of that effort. So I'd like to bring Ambrose into the conversation, please. Good evening, Ambrose.
Thank you. Thank you so much. And I appreciate the invite to be here to share with you. On August 31st, we had an event in Ward 8 in Washington, D.C. And of course, that's where the heart of the issue is in terms of opioids and fentanyl. It's part of the east of the river communities of Ward 7 and Ward 8. And we had it at the Black Box Theater. And we had Dr. Bazran, who is the executive director or the director of the DC Department of Behavioral Health. We had several other people there as well to talk about this issue, talk about the crisis that is occurring in our communities. And let me just go into that a little bit before I get into something that Dr. Bazran mentioned, which was the use of fentanyl test strips as part of harm reduction. Before I get into that, I want to go ahead and paint the picture real quick in terms of what is happening in DC. So from 2014 to 2021, there have been 2,042 opioid overdose fatalities, which is almost double the number of homicides that occurred during the same time in the District of Columbia. And through May 31st of this year, from January to May, there have been 166 deaths due to opioid overdose. Now, around the country, and Larry mentioned some of this, there have been 108,000 people that have died from opioid overdoses. And just to give you a perspective, the amount of fentanyl that has been found in those 108,000 deaths, 66% of them have had fentanyl. Whereas in DC, 96% of the overdose cases have had a connection to the opioid drug fentanyl. And so fentanyl seems to be the real culprit, which is, it's so much deadlier than heroin and so much deadlier than other opioids, up to 100 times more lethal than some of those other drugs that we know of. And so, but and when we talk about what's happening in DC, we also have to look at some of the reports that's coming out of the Chief Medical Examiner's office. So, for example, in this past year, there's been a little bit of a reduction in use in the under 20 age group. But we are also seeing a projected increases in the 20 to 29 age group, the 30 to 39 age group, and the 40 to 49 age group, with a projected 100 deaths in the undomiciled, in other words, the ones that are unhoused, 100 deaths in the unhoused population. So, the 50 to 59 age group remains the highest and is expected to plateau at around 120 for the third year in a row. And so we really have a real crisis going on in DC. And now there are reports that you're finding fentanyl in pill form, and it's made to look like Skittles. It's made to look like candy.
Well, I was going to say the first time I heard it was when I was in the session with you, when we attended the session in Ward 8, but it has been on the national news since then. And I just wanted to bring that to your attention. So you made us aware of it, and now it's become more of an issue nationwide.
Yes, well, the DEA actually issued a warning last month about it,
Mm-hmm.
and so that has been since almost since the event that we had. And to another note, another way that it's been spread is that they're sprinkling fentanyl on roses and they're handing it out to women in the community. So when the women smell the roses, they're actually ingesting fentanyl, which of course is an opioid and can result in an overdose. And they found these rainbow colored pills, certainly meant to appeal to younger people, in 21 states, 21 states. And so, as Dr. Bazran mentioned, the fentanyl strips are a harm reduction method. And so, and I know that we're going to be having a fentanyl test strip demonstration on this
Yes.
video right here. But
Mm-hmm.
that is one of the ways in which you can find out whether or not the drug that you're using or something that you're ingesting has fentanyl in it, whether or not you use the test strips for a marijuana cigarette or a regular tobacco cigarette, or for a pill. You can test to see the fentanyl, whether or not fentanyl is in that particular substance. And if you can do that, then you might be able to avoid an overdose.
And Ambrose, I know that there was a hint of controversy, particularly, and Dr. Bazran addressed this specifically, and she said, there's a risk either way, but the point is that we want to make certain if we can protect those to allow them to protect themselves, the ability to use the strips, whether you feel one way about it or another, I think is also a prevention method as well.
Yes, and getting back to the point of fentanyl again, that is really the culprit. And the fentanyl is coming from Mexico and drug cartels in Mexico, and they're actually getting the substance because it's man-made. It's not a naturally occurring substance. They're actually making it from chemicals that are brought in from China. And so this is an alarming state that we are in because it's now spreading out around the country. Of course, to counter any kind of overdose is the administering of naloxone, or better known as Narcan, to someone that appears to have overdosed. And so, I as you have, Garcia, I've been trained in Narcan administration, and so it's something to really spread throughout the community. Get the Narcan to be able to utilize it if you see someone that's overdosing and that person might appear to be falling asleep or in a state where they can't really wake up. The administering of the Narcan is not harmful,
Mm-hmm.
even if that individual was not overdosing. By administering the Narcan just in case, it does not negatively affect the body. And so, I could get a Narcan tube and spray it up my nose now, and nothing would happen to me. So,
Right.
but it's very effective in terms of countering the overdose of the fentanyl as it interacts with the brain.
So what we're going to do for our listeners, and thank you so much, that's Ambrose Lane Jr., the chair of the Health Alliance Network. And he's not going away. He's going to stay with us for the rest of the day. But as Ambrose indicated, tonight's session is about training, education, and enlightenment. So now we're going to offer a fentanyl demonstration. It's a very short snippet of a video, but very powerful in terms of what it allows for you. And then we'll have a PSA that you'll be able to share just to gain more insight from the community about the importance of fentanyl. So let's go to the video. Ambrose, stick around. We'll be right back.
Hi, I'm Roseanne, and this is Abby, and we're peer navigators with the Erie County Department of Health.
As peer navigators, we have lived experience with substance use disorder.
We have seen firsthand the damaging impact of opioids and other substances on people we know and on our community.
We have also seen how harm reduction strategies like the fentanyl test strips we are about to demonstrate can reduce the risk of overdoses and death.
If you're watching this video, you probably know why it's so important to use one of these test strips on any drugs you are going to take.
But we're going to say again why it's important to have fentanyl test strips on hand.
Unless you're getting your own prescription medicine from a licensed pharmacy, you have no way to tell what is actually in the drugs you are going to take.
We have too many cases in Erie County where someone used cocaine, heroin, ketamine, club drugs, pills, or other substances that contain fentanyl, and they died of an opioid overdose.
Fentanyl is a powerful opioid which can cause you to stop breathing and lead to death.
By showing how to use these fentanyl test strips, we are not advocating for drug use. We just want you to stay alive.
To use the strips, open the package and take out the strip.
You will want to have some clean water, a small, clean, and dry container or plastic bag, and a way to measure a half teaspoon.
Put a small amount of drug residue in a clean container or bag and add a half to 1 teaspoon of water.
Hold the test strip at the solid blue end and insert the wavy end into the water for 15 seconds.
Take the strip out of the water and wait at least 5 minutes. Then look at it in full light and count how many lines have appeared.
A positive test result, 1 red line, means that fentanyl or a similar synthetic opioid is detected in your drugs, and using this substance is extremely risky.
A negative test result, 2 red lines, means that fentanyl or a similar synthetic opioid was not detected in your drugs.
Invalid test result, no red lines, means that you should retest your drugs.
But remember, no test is 100% accurate. Test strips are one of many harm reduction strategies that you should use if you are using any substance.
These test strips reduce your risk of overdose and death. They don't eliminate that risk.
Number 1, have Narcan, also known as naloxone, on hand. You can text 716-225-5473 to have Narcan mailed to you for free. The only question we ask is what address to send it to.
An opioid overdose is a medical emergency. Don't hesitate to use Narcan and call 911 if you are with someone who has overdosed.
Number 2, never use alone. Have a trusted person with you, and if you are using together, take turns. Go slow by taking small amounts and waiting in between uses. Consider calling the Never Use Alone service at 1-800-484-3731.
Remember that Erie County has resources for you and family members. The Buffalo and Erie County Crisis Services Addiction Hotline can refer you to the support you may need. Call 716-831-7007.
Fentanyl is a synthetic opioid that is 50 times stronger than heroin and 100 times stronger than morphine.
It is often added to other drugs because of its extreme potency, which makes drugs cheaper and more powerful, more addictive, and more dangerous.
Drugs may contain deadly levels of fentanyl. You wouldn't be able to see it, taste it, or smell it. It's nearly impossible to know if your drugs have fentanyl unless you test your drugs with a fentanyl test strips.
The DEA issued a warning this week about rainbow pills that contain fentanyl. The colorful pills, which are highly addictive and potentially deadly, were seized in 18 states in August.
Brightly colored pills look like candy and effort by drug cartels to appeal to kids and young adults. Fentanyl is often seen in blue, greenish, or pale color counterfeit pills. There may be other colors.
These pills may be marked as M30 and sometimes as K9, 215, and V8. Fentanyl may also be in the white powder. Oxycodone pills that are sold on the street or online are likely to contain fentanyl.
Bottom line is fentanyl ain't good for none of y'all. From the Obsession Band, stay clean.
Thank you. The PSAs, I think, are so critical to sharing information and what needs to be known in our community. So again, the fentanyl test strips and the demonstration was intended to give you an overview of an idea of the resources that are available to you so that we can be more proactive in preventing drug overdoses. Treatment and recovery is extremely important, but the prevention is as well. So we're going to continue the conversation. You heard from Ambrose Lane Jr. We're going to bring Ambrose back, but also we want to bring into the conversation Joanna Dolan. Joanna Dolan is the founder and CEO of Dolan Research International, and we want to hear her perspectives on several factors concerning recovery services. She did a series of webinars for us, so I'd like to welcome Joanna into the studio. Hey, Joanna, how you doing?
Good. How are you?
I am well. So we're going to bring Ambrose back shortly, but I wanted to just get your perspective on National Recovery Month and some of the work that you've been doing during this period.
Yeah, sure. So first, thank you for doing this. This is really important. It's very necessary. And some of the stuff that we've been doing for Recovery Month has been doing webinars, community education, educating peers. We've done several tip in the pain scale events, including an event at Twitter. So that was fantastic. And then we've had the mobilized recovery events going on as well. And then, of course, I'm part of the Peer Recovery Center of Excellence. And so we've had events all throughout the country. If you are looking for information about how to support peers, you can certainly go over to the Peer Recovery Center of Excellence's website for information about how to train, like how to supervise, how to integrate peers into your settings.
Now, one thing that we talked about again is resources. And one of the webinars that you did with us talked about resources that are available. And when I think of resources, obviously with the Medi Community Resource Center, via our website at themedi.org, you can actually go there, and by typing in your zip code, you can gain some additional information about resources in general that are at reduced or no cost concerning just your overall wraparound in terms of rental assistance, food deserts, food deprivation, transportation. So those are resources in general that everyone needs, and certainly this population, those that are impacted by substance abuse disorders, can benefit from that. But what are some other resources that you can recommend in addition to those through an organization like the Medi Community Resource Center? What does Dolan Research International offer in terms of resources to the community?
Yeah, I'm glad that you asked. Well, so one of the first things that we would do is we would talk to people about the importance of building their recovery capital and looking at questionnaires like social determinants of health to figure out like what does a person need. And then we do send them to the Medi's website to find local resources. We also suggest people to connect with the peers in their communities, to check in with the health departments. There are several services that are available, whether that is getting Medicare, Medicaid insurances, going for food stamps. Like there's no shame in asking for support when you need support. Some people are eligible for things like unemployment and they just don't even realize that. So taking full advantage of all the things that are available to them, that is what we do. And so those looking for resources can be something as simple as contacting a local recovery community organization. In fact, your local recovery community organization or a senior center, those places really have the lock on what is happening, who's the person to talk to at each of the different organizations. And yeah.
I think it is extremely important to enlighten and educate at the same time, but again, availability of resources. I'm going to bring Ambrose back into the conversation if we can, and just dialogue a little bit about the needs within the community. Let's just chat a little bit about your perspective on what it takes in order to address some of the same issues we've been talking about. Ambrose mentioned a variety of different age populations. And I think a lot of what has come about right now is focusing on our young adults and youth. Any specific messaging or thoughts about that and ways that we can address that population, short of what we talked about earlier with, the Skittles and trying to Skittle-like, fentanyl that's impacting that demographic in the community. But in general, let's talk about our children and ways that we can protect and support them.
So the Health Alliance Network created the Opioid Solutions Working Group, and it's a working group of a number of different organizations that are working in the opioid space. And one of those organizations is the Ward 7 and 8 DC Prevention Center. And they actually do a lot of community education, particularly reaching out to young people. They have a youth education core. And so they particularly reach out to young people in terms of the messaging, in terms of opioids. But one of the things that I think we need to do moving forward, we need to be able to have stronger messaging that really comes from, say, for example, our DC Departments of Health or DC Departments of Behavioral Health, that all of the organizations that work in the opioid space can push, which is that fentanyl is a poison, and that we really need to call it for what it is, put it on posters, put it on community message boards, put it on flyers, and get it out there in the community as well as through the leadership of these organizations, and say what it is. Fentanyl is a poison which can kill you. And so when you talk about, as I mentioned earlier, where they have prescription looking drugs that look like Skittles, that have been found in 21 states already, that's a real concern, and because that's a purposeful attempt at trying to reach young people, to expand markets of those that can become addicted. And so we have to warn our young people that to watch out for these kinds of things. And so those are some of the things that can happen. We can also continue to have, as you all know, use of peer advocates, as well as the use of those other young people who can actually testify on these issues. There's a whole number of things. Community conversations are always good to have. And so having community conversations with young people, maybe having a peer advocate or a peer specialist actually talking to them during these types of sessions would be absolutely impactful when we're talking about trying to reach young people.
Well, I know we had one of our community conversations, and we had a parent from DC Public Schools, and her commentary adding to that is more discussion about it. She said because right now she felt that her middle school child would gain better access to prophylactics than they could any drug material. So you can find things related to reproductive matters, but not certainly the drug matters. So I think
I'm not sure about that, Garcia. And
well,
I'm
that was her comment. That was her comment.
Okay, so
and I just received it, right.
That's why the education needs to take place, because they're finding these rainbow colored pills in middle schools. So this is not something that you're walking the street and you find. They are being distributed at middle schools.
And that was her concern. And that's what she was referencing. So as much as we can get inside and make that happen. Now, Joanna, I know that you obviously are an advocate and very supportive of the LGBT community. So I wanted to just have you address in some way that segment of our population and what we can do to better engage in that dialogue or that discussion, or what you're doing, because I know you're on the forefront for your population.
Yeah, thanks for asking that. Actually, I was thinking when you asked about where do we send people for resources, right? Like sending people to the local LGBT centers is a very important thing to do. We have a really vibrant LGBT community in the DC area. And there are many, many resources that are connected to it, right? So doing things like consider writing articles or putting out information in the Washington Blade, or considering going to LGBT health clinics, consider having LGBT specific education about the drugs that are being used in our communities, which do include things like opiates, right? But it also includes party drugs and those types of things. So being able to have harm reduction conversations, as well as being able to provide connections to organizations that support LGBT addiction recovery services.
Well, one of the things that I know came up earlier in our conversation was about prevention, and Ambrose did an amazing job in talking about fentanyl and giving us the ills, and then we led into the fentanyl demonstration, and we had a few little hiccups, and then also I think with the PSAs, we may have had some technical challenges there too, but we did talk about Narcan. So, Joanna, can you address Narcan? And then the next segment will be a Narcan demonstration that we'll be able to share with our listeners.
Sure, absolutely. So Narcan is what we use to reverse overdoses. And having Narcan in your home, in your car, at your place of business can be extremely important for many reasons, right? It is because people are being prescribed opiates, and you may not know that. People are prescribed opiates for pain meds for surgery or for chemotherapy. Lots of older folks are being prescribed them, and sometimes, less and less now, but kids are being prescribed it for the wisdom teeth removal. So knowing that there's the possibility that someone at your place of business has opiates and may have even forgotten like how often they took it is important, right? And then of course, like we need it in our cars because we don't know where we're going, and if we're going to see someone who is actively overdosing, whether are because they are a drug user or because of something else. And so having that with you is a key to saving someone's life right there in the moment. And we talked about Good Sam laws, right? Like Good Samaritan laws are really important, because if you help and save someone's life, you're not going to be persecuted for it. You're going to be celebrated for it, most likely. In fact, that's one of the key things, right? Is we want Narcan to be so available to save people's lives that there are organizations that are built solely around educating and distributing Narcan. We also have it widely available throughout the city. You can get it at the recovery community organizations. You can get it at the hospitals. You can also get it at the Behavioral Health Administration or the health department. We have a link that we can share with you if you're not able to go out. Like you can click on this link, receive some Narcan training, and get some sent to your house.
And pharmacies too, Joanna. You can go to your local pharmacy, and they most likely have it as well.
Oh, I love that. Thank you.
That is important. So why don't we go to the demo so people can actually see it in operation if they've not actually had training, but the training that I've had has been very valuable and supportive. So I now understand what my role and responsibility will be. So let's go to the training and we'll be right back.
Nasal spray is an emergency treatment for a known or suspected opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, Kevin, can you hear me?
Check for signs of an overdose. Seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children.
Well, that certainly gives us some tremendous insight in terms of resources that are available to us as community members. And as Joanna mentioned earlier, the Good Samaritan laws do protect us. I know in previous instances and years ago, there were some areas where if you got involved and there was some responsibility on that individual's part, but your attempts to save a life can really make a difference. So certainly read up on that within your individual community, but know that there is a role for you to be able to play in this effort. I'm going to ask Larry to join us again. And Larry, this is really important as we begin to bring our culminating event, our concluding event to a close. I just wanted you to share your perspectives in terms of your responsibility as the director of peer recovery services and support at PIW. I do want you to unmute your mic though, because I do see that you're muted at that point. So let's make sure you do that. And take a few minutes to just share exactly what that represents and what your responsibilities are and why the community needs to know about what it is that you're doing at PIW.
Well, thank you, Garcia, and thank you, Ambrose and Joanna, for this tremendous information that y'all are bringing, and also highlighting, particularly Joanna, the power and the role of peers. So peers are individuals with lived experience, who've been through the throes of addiction and was able to get into treatment and establish themselves in recovery. And and what is common among peers and individuals lived experience is this unique compassion, this unique understanding of the challenges of this chronic disease and the needs as it relates to what is required to get in treatment, to get established in treatment, and to stay in treatment and get established in recovery. Peers finally are being recognized. They've long been recognized, but only now are they really getting the highlight and the recognition and the integration into the treatment teams where they are truly can make an impact and are making a tremendous impact. We know when peers with lived experience is on the treatment team and when they're engaged with individuals who are in the throes of addiction and treatment and recovery, it makes all the difference in the world. And it's one of those key recovery capital elements that you had highlighted in terms of what Joanna's been presenting. And that is the sum total of what you bring to the fight, if you will. And so the peers are right there by the individual side, but they bring this special and unique connection that is probably unique to this disease state. And we always say that, treatment without recovery essentially, the individual will essentially relapse and will have a really hard time getting where they need to go. And so, peers with lived experience, and we are on the front lines, and we're involved in some value-based care demonstration projects. We're involved in some care coordination, inpatient, outpatient, and across the healthcare continuum initiatives to really showcase and to really capture and document the power and the need for peers. And we need to really build capacity and expand and more access. And only then, can we begin to turn the tide, if you will. And I also just like to highlight the work that Ambrose has been doing here in the district, particularly focusing on building capacity and really giving peers the resources that they need. And he has been the advocate, if you will, and he has really marshaled the community. He's marshaled the thought leaders through the Opioid Solution Group, and he's really marshaled the policymakers and has really put this to the forefront in terms of what the district needs and what the residents of the families and individuals who are trapped in this vicious cycle of treatment and relapse, the resources they need and the resource that peers need, to try to make a difference and to improve outcomes. The outcomes are just fairly dismal. Getting established in recovery is, is equivalent, winning an NFL draft. That's just how, how poor the outcomes are.
Well, and
and we can't do without peers.
And this is straight talk because most of the time you don't hear this level of conversation. And what you're reinforcing is that each of us have some level of responsibility, whether you're clinicians, whether you're housed, within a facility, a community advocate, as you mentioned with Ambrose. You also talk about resources like what Joanna brings to the table, and even with the Partners in Care Network, there are so many various facets that are going to make a difference. The numbers don't show what our efforts are, but it doesn't mean that we stop doing the work that we're doing. So I do want to commend you and the work that you're doing at the Psychiatric Institute of Washington. And the time is drawing near. We're going to have to roll out of here. And I apologize because you may hear those sirens outside the window here. But the idea is that as we bring Recovery Month to a close, there are so many things that we hope that we've encouraged or enlightened you about, and to encourage you to get involved in your community. There are various ways to do it, and we've highlighted some of those, and you'll have a chance to come back and review it again and share it with others within your community to say, hey, you didn't catch that production that was surrounding the conclusion of National Recovery Month. So as we prepare to close, one of the things that Larry was very adamant about us including was some way to memorialize and celebrate and honor those individuals. So we're going to ask that as we prepare to bring this broadcast to a close, that you think about someone that you would like to honor, someone that you would like to celebrate, an organization or an individual in terms of the work that they've done. And we are going to give you an opportunity to speak their name, to share exactly what it is that you would like to see happen, and maybe to be able to encourage someone to do that. So we're going to allow one of the members of the Partners in Care Network, being represented by Dr. Zarfashan Zaid, to take us out and to give us some focus on exactly what her role is in terms of this process. So thank you, Larry, for being a part of this. Thank you, Ambrose Lane Jr. and the Health Alliance Network. And thank you to Joanna Dolan. Special thanks to our team. Deanna Malloy is our tech in the background, and she's tolerated a lot working with us. Stacey Palmer helped us tremendously in organizing and putting together the various components. And we'd also like to give special recognition to David Mays and to Tom Carl, neither of which could be with us today, but they've been a part of our effort. And then finally, to the Ward 3 and 4 Prevention Center, Nadine Parker and Janetta Joyce, who've given us the opportunity to be able to share and be a part of National Recovery Month and the Prevention Center in Ward 3 and 4. Thank you all for joining us. Please share within the community. And next, we'll have Dr. Zarfashan Zaid to conclude our session for today.
Good evening, everyone. My name is Dr. Zarfashan Zaid, and I am the Director of Clinical Operations for Medical Home Development Group. Now, although September is National Recovery Month, for us at Medical Home Development Group, every day is a day for awareness, for support, for treatment, for recovery. We see individuals daily who are struggling with an addiction, and at times they're coming to us when they have hit rock bottom, when they have lost all family and friends, and at times even lost hope. We work with these individuals and help them understand that addiction is a chronic disease, and it's not what is wrong with you, but rather what happened to you. We treat them as a whole and not just a disease process. We work with various organizations in the district through our Partners in Care network to help eradicate stigma and the barriers to accessing care. We encourage individuals to get help, provide hope, lift up voices, and put a face on people in recovery and not the disease. By treating every person, every family, every community, we can change the path of so many lives. So I'd like to take this moment and light this candle to honor all individuals that have faced adversity and shown resilience in their journey through addiction and recovery. I'd also like to commend those support systems, whether it be family, friends, healthcare organizations or providers, or any other organization, including churches, that have been there to help these individuals. You truly have been that light at the end of a very dark tunnel. I thank you.
I light my virtual candle for all the people that we have lost this year and all of the people that we still have because they just won't give up. Thank you.
I light my candle for all of those that have passed in the District of Columbia, with a special recognition of Jayla McBroom, the daughter of Kiki McBroom, Ward 8 ANC Commissioner, and that we have to continue the fight to try to reduce and eliminate opioids from our community.
I light this candle in honor of everyone that's in the struggle. It truly takes a village. It truly takes the community. And I want to especially honor Jamie Freeman, who was the first peer recovery coach at Psychiatric Institute of Washington. And as you know, we've lost her, but not forgotten. And we will continue to honor her going forward.
I light my candle for the frontline responders, for those who work with those in recovery every day. We know that it's a tireless effort that you have to dedicate every day in order to make a difference in the lives of those that you support. We ask that you stay strong, stay focused, because the work that you do is extremely important to each of us. We thank you. Have a good evening.
Yeah, this is Sugar Bear. Ow, that's right. I'm trying to figure out what's the matter with us. All this evilness among black on black. Why? What is going on? To know better is to do better. You heard me?